What if the medicine meant to help you actually makes things worse? That's exactly what happened to Alex, and the reason? Hidden in their DNA. This is Alex. Before today, he didn't know what pharmacogenetics was, why it's important, or how it connects to something called precision medicine, a revolutionary approach to healthcare that moves beyond the one-size-fits-all treatment. Just as we all look different on the outside, we're different on the inside too. Our genetics shape everything from our appearance to how our bodies respond to medicine, and that's where pharmacogenetics and precision medicine come in. Pharmacogenetics is a specific scientific field that studies how small genetic differences impact how we process and respond to medicines. Some people process drugs too quickly, some too slowly. Precision medicine, which you may know as personalised medicine, takes this idea even further by integrating pharmacogenetics with other scientific areas and considering lifestyle and environmental factors to create treatments tailored to the individuals. Through the insights of experts in the fields of pharmacogenetics and precision medicine, we'll take you through a real-world example of how our genes affect the way we respond to drugs and why understanding this can save lives. And right here in Glasgow, researchers are leading groundbreaking studies in pharmacogenetics and precision medicine, helping shape the future of personalised healthcare. Alex enjoys hanging out with friends and playing tennis, but accidents happen, and on this specific day, he falls and badly breaks his arm. At the hospital, Alex undergoes a routine procedure to realign the broken bone. Everything goes smoothly, and due to the pain, he's prescribed codeine, widely used for pain relief after operations. At first, Alex thinks the painkillers are helping, but then dizziness, nausea, headaches, a strange feeling that something isn't right. The pain from his arm had gone, but these strange symptoms had started and weren't getting better. Could these symptoms be connected to his medication? Alex and his mum check the patient information leaflet, but aren't sure. They decide to visit their GP and with some simple testing identify the problem, an adverse drug reaction, or ADR. So what's happening in Alex's body? The answer lies in his genetics.
I'm Dr. Stephanie Lip. I'm a clinical senior lecturer in pharmacogenomics at the University of Glasgow. In addition to this role, I'm an honorary consultant in clinical pharmacology and general medicine at the Queen Elizabeth in Glasgow. So an ADR is an adverse drug reaction. It's when someone has taken medications and developed unwanted side effects like headache, nausea, or rash. This is influenced by someone's genetics, which affects how an individual metabolizes certain medications. In this case, for Alex, he has genetic factors which explains his adverse drug reaction to codeine.
Codeine is well absorbed into the body, but then needs to be converted inside the body to its active form. It's a type of medicine known as a prodrug. For the body to do this, it needs the help of an enzyme, a type of protein that speeds up chemical reactions. The one responsible for this is an enzyme in the liver with the catchy name of CYP2D6, an acronym for cytochrome P450 family 2 subtype D member 6. CYP2D6 acts as a processing station, transforming codeine via a complex metabolic pathway into morphine, the actual compound that leads to the pain-killing effect. But not everyone's CYP2D6 enzyme works the same way. Mutations, like substitution in the DNA that are part of the CYP2D6 gene, can affect the metabolism of the drug, which is how fast or slow the body processes the drug. People process codeine at different rates depending on their CYP2D6 enzyme. Normal metabolizers convert codeine at a steady rate, producing just the right amount of morphine for effective pain relief. Ultra-rapid metabolizers process it too quickly. Their CYP2D6 enzyme works at an accelerated rate, flooding the body with morphine too quickly. Alex's CYP2D6 enzyme is working too fast, overwhelming his system with morphine and causing an adverse drug reaction. The medication is relieving pain, but the side effects are making him feel worse. This is why the same drug can have very different effects from person to person. A simple genetic test, just a quick swab inside the cheek, can reveal how Alex's body processes codeine. But this isn't instant. The swab is sent to a lab where scientists analyse his DNA. In the lab, researchers examine Alex's DNA looking for variations in the CYP2D6 gene. This kind of cutting-edge research is being used right now at the University of Glasgow and within NHS labs, where scientists are working towards making treatments safer and more effective. This test reveals whether Alex's CYP2D6 enzyme functions normally, too slowly, or too fast, helping doctors predict how he will respond to the medication. Alex's tests confirm he is an ultra-rapid metabolizer, meaning his body breaks down codeine too quickly, flooding his system with too much morphine and causing side effects. With this information, doctors can make better treatment decisions, such as prescribing a safer alternative or adjusting the dosage.
I'm Ian Frater. I am a research fellow at the University of Glasgow and a medical registrar here at the Queen Elizabeth. We can predict how some of your body is going to function based on the genes that you have. Generally speaking, you get one copy from mum, one copy from dad, and then you get a little bit of the world impacting on top of that. But with those copies, we can predict whether your enzymes are going to work normally, are going to work in a superhuman manner, or are going to work in a really slow manner. And we can use that to predict how you're going to respond to individual drugs.
So, what have we learned? Pharmacogenetics helps us understand why drugs work differently for different people. Codeine is a prodrug that requires activation by an enzyme called CYP2D6. Genetic testing for CYP2D6 or other genes can predict how individuals will respond to medications, allowing doctors to prescribe treatments which are the safest and most effective. Genetic variation can lead to faster or slower processing of drugs, meaning either there isn't enough or there's too much in the patient's body, respectively. Pharmacogenetics is just one part of precision medicine. While pharmacogenetics focuses on how genes affect drug metabolism, precision medicine takes a broader approach by integrating pharmacogenetics with other factors, genetics linked to disease causation, lifestyle, environmental, and other factors like family health history to find the best treatments for each person. It's not just about preventing adverse drug reactions. Some medications don't work at all for certain people. A drug may have no effect or cause unintended side effects, often due to our genetics. That's why research in this field is so important, helping people like Alex get the right medicine the first time. The University of Glasgow is at the forefront of pharmacogenetics and precision medicine, leading clinical trials and pioneering real-world applications of this research. The university's Living Lab is actively working with healthcare providers to bring these advances into everyday medical practice. Visit the University of Glasgow's Living Lab for additional resources on pharmacogenetics and precision medicine.